Hey, good morning. It's Steve Stites, Chief Medical Officer here at the University of Kansas Health System, broadcasting live. I didn't take this off yet. And why can I take it off? Because I am more than 6 or 7 feet away from these guys, and we have the right kind of airflow in the room. Otherwise, you should have your mask on. Remember that. How do you keep us safe from this little guy? Mask it up. And what do? You keep the whole world safe. That's the way to go. So yes, we're broadcasting live from the Dolph Simons Family Studio here at the University of Kansas Health System. I am joined by Hawkeye on the right, as always, and on the left, Amanda Gartner, our infection, what is the right title? Director of Infection Prevention and Control, Vice President, whatever your thing is. She does great work here and really has been at the backbone of our response to the COVID crisis, especially as we look at things and measures of how to have the right infection control in place. On the phone is Heather Harris, the Chief Medical Officer over at our Medical Director of Hayes Hospital, and she's going to be letting us know how things are going there. But first, after I stumble through the opening, because it is, after all, Friday, and I'm lucky to still be awake.
Yeah.
Hawkeye, how are we doing?
I think, we're doing pretty good still. We're in the low 20s. We have 21 today, 6 on the 6 in the ICU and 2 on the ventilator. Again, we still have another 32 patients total in the hospital who were originally admitted for COVID reasons.
So a total of 52 folks here kind of filling beds as a result of COVID.
Yeah.
Quite a big number, though, overall. That's like 8% of our overall hospital beds.
Yeah.
And if you included all the beds we lost from having to convert those 45 semi-private rooms, that's a loss of 45 beds. Yeah. That's a lot of beds that are affected just by COVID. That's like 90-plus beds.
Yeah, absolutely. And we were really doing good in the KC metro area in general as far as downtrend for rolling 7-day average of number of new cases. But the last few days, that number has trended up as well. So.
Yeah, and even in the United States, they've been trending down, and now it's kind of beginning to flatten out again. You can see that and things. So, Heather, how are things out in Hayes today?
Good morning. So our total census in Hayes is 11. We have 7 in the ICU, 4 on the acute floor. We have no ventilated patients as of this morning.
Yay.
Luckily, all of our recovered folks have gone home, so we don't, at this point, have anybody in the hospital recovering. Everyone has went home. So, yeah, that's been our trend, somewhere around 8 plus or minus. And a few more here the last several days. And then our percent positive for the week has gone down just a little bit. So we're happy about that. So hopefully that'll improve our hospitalizations as well over the next few weeks.
You bet. And what is that percent positive rate looking like in Hayes?
We're 14 for the 2-week, I believe. I think the 7-day might have been 11. I wish I would have looked at that quicker this morning, but I looked at that yesterday. So,
no worries.
But everything was trending downward.
Okay. So, Amanda,
yeah.
How are things? And I love the red. Well done. I know it's big. It's Red Friday. I even watched a little Thursday Night Football last night while I was eating dinner, so I should have thought about that. So, anyway, what's going on?
With infection control or with COVID or what,
yes,
what specifically?
With the Chiefs, you name it.
I mean, they're playing on Sunday.
Yeah, I know. Big game, 325. Kickoff charges. We're going to win by 10.
Okay. All right. Good prediction.
Yeah.
We're just staying steady, making sure that we have the right PPE here in-house to take care of our COVID patients. And we're really ramping up our ability to take care of like every other patient that comes into the hospital and doing what we can to get back to normal, the
quasi-normal that we're going to be in for
a
while. So you took a tour of the KU campus this week.
Yeah.
How'd it go?
So I go to the KU Lawrence campus about once a week in support of our Kansas team health efforts and working with them as they're returning to campus. I took a look at our new swab clinic that we established earlier in the week on Wednesday, and then I do spot checks with the athletics team. So I had the opportunity to watch a little bit of volleyball practice, a little bit of football practice, and some workouts in their wonderful workout facilities. And then just drove around campus a little bit to keep an eye on their masking practices and social distancing. I would say this week was not quite as good as the last time I was there, which was probably about 2 weeks ago. More students were grouped together, and maybe the last time I was there, I only remember seeing about one person without a mask on, and this time I saw about probably 10, 12, 15 folks who weren't wearing masks with close proximity to other students. So I think just constantly reminding that culture of masking, even if you are with friends or new students at your meeting, it's still extremely important for them to have that masking practices in place.
Yeah, so we just have to remember that someday we're going to have a vaccine, some days we're going to have effective therapy, but for right now, the most effective thing we can do, wear a mask, socially distance, do the right thing.
Yeah, and I think it's really critical that even once we have that vaccine, that some of these practices are going to continue.
They are going to continue. That's exactly right, especially as we get into the twindemic season with both influenza and COVID. Hawkeye, thoughts?
Yeah, new research has just come out showing that, there has been a decrease in overall influenza since the institution of all these new public health measures. So, we are optimistic, but we still need to continue to get our vaccines. We need to get vaccines as adults. We need to catch up on those, especially the tetanus and pertussis vaccines, the shingles vaccine, obviously the influenza vaccine, and more importantly, we're seeing more news that children, since the start of the pandemic, have not been able to get their routine childhood vaccines. And I tell you, if you are a parent, we don't understand the impact of these diseases because we haven't seen them. But you want your child to be protected from these easily preventable diseases, and the way to do that is through the vaccines, because you don't want them to suffer through those illnesses that everybody works so hard to develop these vaccines for. They developed them for a reason, because those vaccines caused a lot of morbidity, a lot of illness and suffering for the children, and even sometimes death. And we have easy ways to prevent them. So please talk to your primary care providers, talk to your physicians, get your children vaccinated, keep them healthy.
Excellent advice. All right. Well, Jess, how are things going today?
Hi, good morning. How are you?
Good morning. Good morning. I bet we have a lot of questions today. I guess we start with seeing if there's any questions from our media colleagues today.
Hi, guys. It's Taylor at Channel 41. How are you this morning?
Hey, Taylor. How are you?
Taylor.
Welcome back.
Good. Thank you. Thank you very much. Hey, this is kind of a media question and a parent question. I'm trying to do two birds with one stone here.
You bet.
As we get ready to, a lot of people send kids back to school, potentially those that are still virtual learning that may start sending them back. Are we compounding exponentially if we also add other activities that we haven't been doing on top of that, like sporting events or that kind of thing? Not necessarily going to birthday parties, but if I put my kid in school, am I a certain risk factor, and then raise it even more if I also put them back in baseball or basketball or some other thing like that?
Well, my answer to that's going to be yes, Dana, but what do you think?
Yeah, absolutely. Anytime you're doing something out of the ordinary, anytime you're doing anything that will increase your bubble and increase your interaction with other people, there is going to be a level of risk associated with that. We don't know the full impact of what the school opening has been in the United States so far. Hopefully within these next, say, 2 to 3 months, we'll be getting some of that early data back to show what that impact has been. But if everybody can continue to do the distancing and the masking, and that is the people associated with those activities that you're talking about, but also in the school with the children and the teachers and the other adults in that school, you're going to reduce the risk as much as possible. But overall, doing more activities, interacting with more people, you are going to introduce more risk.
Yeah, and that is one of our big struggles, and you just have to make that personal decision we've talked about at home and weigh those risk factors. Amanda, are there things that parents can do to try and keep their kids safer?
I'll tackle that question,
Please.
but just as a sort of add-on to what Dana was talking about, depending on the classroom environment, specifically what is the curriculum and what are the types of activities that are going on in that classroom, there might even be different levels of risk within the same school. This is an example from KU Lawrence, but like sitting in a math class or a history class is very different than sitting in like a music class where you're actively
spreading the virus as you play an instrument.
Yeah,
yes.
if you're playing an
as
instrument.
a former French horn player, I understand.
Or if you're in a drama class, or if you're in a speech class or a language class where you're actively talking, and really, I mean, it depends on the activities that you're doing within that classroom. So I think there is even a risk assessment that you have to consider just based off of not just going back to school, but also the activities that are going on in school. I don't think there's anything new to how can we keep folks safe, it's really going back to the very basics of reminding children to socially distance, the importance of wearing the mask, the importance of if you've touched your mask that you need to do hand hygiene. Whenever you're in some more vulnerable situations in a school setting, might be during, if there's snack activity or snack time or lunch activities where you're eating or drinking, how important it is that now you have your mask off, you're more vulnerable. So really maintaining that social distancing and encouraging the hand hygiene.
Yeah, and I've had to even reinforce that with my son. You know, when you aren't actually playing or when you're sitting on the sidelines, standing on the sidelines, when you're in practice and you're not actually doing drills, try and just distance yourself from your other teammates. You know, just take a few steps back, and if you can get that, take another few steps back. So, but yeah, unfortunately, since the pandemic, I haven't been able to play my vuvuzela because of that.
Your what?
My vuvuzela.
Your what?
Well,
It's
you have to look it up.
the highest risk
It is the
instrument.
highest risk instrument.
Come on.
Okay, so what is a vuvuzela?
Have you
I can say it.
heard the soccer
Well, it
games?
became popular in the South
that's
African
the
World
vuvuzela?
Cup.
Oh, God, I know what it is.
But it is actually, I think, deemed the most highest risk of spreading droplets. So if you just take that with SARS-CoV-2, obviously spreading SARS-CoV-2. So.
Yeah, I can just imagine where the tuba goes. Man, straight up.
Well,
French
sure.
horn, it goes so windy, I bet it's all in the piping still. But some of those other instruments, how does that work? Heather, how are things in Hayes as far as reopening of schools, and what's the sense out there, and what's the mask culture like?
Yeah, so we've been in school for, I think, about 3.5 weeks now, and so far it's been pretty successful. We've pulled off a few high school football games and several other athletics throughout the middle school and the high school. And so everyone's masking at school. I know they clean their hands before. I have a high schooler and a middle schooler, so they wash their hands when they first get to class. Then they wash their desk when they get done and wash their hands again. They're wearing masks throughout the entire school. And so far, it seems to be pretty successful. And so we're hoping we can continue to push forward. I know the kids are all really enjoying being there. And it's fun to see them all get to participate in what they love. And then the mask culture, yeah, we're all masking here in Hayes throughout the community, and it's been quite successful.
Awesome. That's good news. Well, good luck with that. You know, I think here's the challenge for us. It's all about the order of spread. You know, I think when the first kid gets it, that's one thing, passes it to another kid who may give it to their parents, and then may give it to another parent or give it to their, then it gets to their parents, and that's when we start seeing the trouble. And that's going to take 6 to 8 weeks after we open schools to really measure the effect of that. So I think we really won't know until middle of October to mid-November what the real impact of school opening has been. The challenge for us will be this. Once the virus starts to increase in the community because of it, just closing the schools isn't going to change that, because now you've reestablished a foothold. So I really think that the way to prevent that is to make sure that, as you've said, I think, Amanda, not very nicely, if the kids will distance there, and you talked about your football team trying to distance and wearing a mask, washing that, then maybe that'll go a little better, and then I think we can try and stay safer. So, but I do think, Taylor, to directly answer your question, the more places where a child goes and is exposed to a new set of people, especially in an environment where there can be, closer associations, or you're exercising, so you're going to breathe harder, you're going to expel more virus, it's going to go further, I think then the risk factors do rise. And I think that's the challenge, is that's exactly what's going to happen.
Because everybody else's bubble is increasing. So if if it's a doubles tennis team, you have one other person you're interacting with. If you have a soccer team, football team, something of that nature, it's just those many more people and their bubbles, and so that just adds to more risk.
Yep. So there you go. Other questions out there? And Taylor, if you have a follow-up, just let us know.
All right.
All right. I'm not hearing any, so Jess, let's get started.
So we've got some really good questions actually coming in today, so hopefully we'll be able to get to those after we get to the ones that we missed this week. So the first one is, have antibody test results improved? I would like to get one.
All right. How is antibody testing, Hawk? It
Yeah.
has gotten a little better, but so much of it depends on the disease prevalence and which test you use.
Yeah, that's a very good question. I talked with Dr. Leisman in our lab actually about this last week. So, we use, our test that we use is validated as very sensitive and specific. So it's a very good test. We don't order them a lot here in the hospital, but we do order them a little bit. They are good. I think more important to that fact is, what is the antibody durability in someone who's had it? That is more of the question. What we are finding out is that the durability, meaning how long does this antibody last in detectable levels, it's different for different people, and especially depending on the severity of illness. There are more new publications. There are wide ranges of how long these antibodies will last in detectable levels. But for the most part, it seems that if you had more either no symptoms or mild symptoms, you may not have detectable antibody for as long as, say, someone who has more severe disease. So it really gets down to the individual. But in general, the antibody test itself that we use here is really good. It is sensitive. It is specific. It is accurate. So I think more to the point is, who were you? What type of disease process did you have? Was it mild or was it severe? And how far are you out from your diagnosis is more important about the detection of the antibodies.
And I think it's important to keep in mind that depending, or regardless of what the result is, it shouldn't change your behaviors.
Correct.
We don't really know what it means in regards to immunity long term, and so it doesn't get you, oh, I don't have to wear a mask now because
Right.
I have antibodies.
Yeah, because it doesn't stop you from being infected.
That's right.
You still get sick.
Right.
Yeah.
That's absolutely right. So I think it's very important to really ask the question, what does it even tell you if you're getting it just sort of out of curiosity?
Yeah. Well, I got one out of curiosity. It was negative, so I guess I'm not.
Which is fine too, but again, I think to your point, it doesn't necessarily mean that you are protected from symptoms if you get reinfected, or more importantly, from spreading it to other people.
Yeah.
All right.
The government seems to be pushing vaccine approval. How confident can the public be in the safety of these rush jobs?
Yeah, let's parse this question out a little bit. How confident can we be in the safety of rush jobs? Well, that would be a problem if it's really rushed. I think the question is going to be, what does the evidence say on the research as it is published? And I think as a physician, and this is what I'm saying to my patients all the time, we have to sit back and we have to establish the safety of the vaccine before we start applying it. And if you have a patient population, mostly who have had cystic fibrosis or post-lung transplant, and you look at that population, I don't want them to take something that may be risky. And so we'll look at the research data as it's published on each of the vaccines to make a determination of its level of safety. The good news is that there are what's called data safety monitoring boards. That's what stopped the AstraZeneca trial because of an untoward event in one patient. And the government may try to rush, or somebody may try to popularize these things, but the reality is that DSMB, that monitoring board, has the responsibility to look at the data of a research drug that's being proposed and say if there's a problem with it. The DSMB is part of any study and is especially part of these large vaccine trials, and they're made up of people who are not from the company, they're not from the investigators, and they're not from the government. They're independent scientists and physicians and other epidemiologists and others who are looking at the data and establishing whether or not there are problems with that vaccine. I think if a vaccine trial is concluded successfully with the DSMB believing that it's been safe, then I will be confident after looking at the data that it's safe, Dana. And I think that's really the key. Yeah. We have to have faith in the research trial design. And we all want a vaccine because we think it's going to make our lives better, and it will. But don't trade something that's higher risk for something that we know works and is really simple and, quite frankly, is low risk.
Yeah. Yeah, because there are a lot of details in that question. It has to be done properly. We already know, again, that there is already a voice of a population that doesn't like vaccines. So we need to also let them know that this is a safe vaccine. If we do it wrong in this time, if the scientists and the researchers do it wrong, that could set back the whole vaccine movement. And that includes everything from the childhood vaccines to the influenza vaccine. So it has to be done properly. And we know that these companies did sign, for what it's worth, they signed a collaborative agreement saying we will be transparent, we will work together to show safety and efficacy and all those things. And so by doing that, having the scientists and the researchers run this and direct this, that is going to be the best way moving forward, because we just have to continue to keep that message that these vaccines are safe and efficacious.
Heather, you're a primary care physician. How do you feel about recommending to somebody that they have a vaccine, the COVID vaccine?
Well, just like we encourage every single vaccine, once the data is out there and they go through the steps just like you all mentioned, these all are invested, and we have to trust the scientists behind it and the research behind it. And once it's there, and present, I'll continue to encourage it, just like we do all vaccines every day, to keep everyone safe and healthy.
Yeah, and I think, Amanda, that it's all about that data, which we'll have a chance to examine.
Mm-hmm. Yeah, absolutely. And I do think it was important that you separate that these vaccine trials really have nothing to do with governmental employees.
Yeah. We need to keep the science lane in the science lane. I have a very good friend who's a PhD in economics. He's not going to come to me and ask me about the United States economy. So on that flip side, let's continue to keep the people who are doing it, who are investing their time and their lives into the research, into the science, into the medical, keep that in that lane, because that will eventually keep everybody else safe.
Mm-hmm.
Well, and I think if we can listen to Fauci on this one, that's probably good advice.
Absolutely.
Because he's been through a lot of pandemics, and he kind of knows what he's doing, and well, actually, more than kind of, he really knows what he's doing, I think.
Yeah.
And people can complain, but he was wrong about this. Well, okay, early in a brand new virus, we don't know everything about it from day one. Yeah, you see, that's why we have science, that's why we have research, that's why we try and learn things. But at the end of the day, the guy's been through an awful lot of epidemics and pandemics, including the AIDS crisis throughout the world, and has dealt with vaccines all around the world. Deborah Birx, the head of the White House Task Force, is a brilliant person, and she has been, really pretty well spot on, and she and Fauci are almost always in agreement. So I listen to those kind of voices, and I trust them. And the problem with politicians is that they're going to have different objectives. Our objective is your health, and we're going to try and give you the right advice on this program.
And, talking with her, you really understand that those two people have really devoted their lives to the health of the whole American public, not just individuals, but the whole population of America.
Yeah, and they're not trying to win a vote.
No.
Hey, you know what? In the meantime, this Operation Warp Speed, and yes, coronavirus today has a Star Trek mask. I want to point this Star Trek mask out, because this was given by some anonymous employee here at the University of Kansas Health System, along with my Star Trek Federation badge here, which I am happy to display this morning. And I don't want to beat me up, Scotty, because we can do this right now on our own. So Operation Warp Speed is, it's been great, actually, because what it's been able to do is get to trials, drugs, and develop the infrastructure and put funding in to make sure the research gets done, and to start building out the structures for distribution of the vaccine. That's the warp speed. The part that's really not a warp speed is making sure the vaccine works. You see, that just takes time. You got to give the vaccine, you have to then follow the antibody levels, you got to see if people are then, if the risk of infection goes down once you've had the vaccine, and how your body responds to it. And that just takes time. And you would love to have, to be able to beam the vaccine right up and have it be ready for use, but it just takes time. All right.
Does a patient have to be severely ill with COVID-19 to get convalescent plasma?
That's a great one,
Yeah.
Hawkeye. So how are we doing on the convalescent plasma? Because once it kind of shifted gears, it was harder to get. So
Yeah, it is harder to get. We aren't using it right now. We are in the process, in the final steps of being able to use it again. But that is a good question. That goes back to what we are talking about staying in the lane of medicine and research. There is a lot of consternation right now in the medical community, because we don't have the best data for convalescent plasma. The best data we have comes from the Mayo trial studies, which we were a part of, and they looked at 20 to 30,000 people. So first of all, it does look safe. It is very safe. But the problem is it wasn't able to go to conclusion before it got the emergency use authorization. And that is then when we changed and weren't able to use it. Now we are able to get it again. But the main point of that is that in those studies looking at efficacy, meaning how much does it help, again, they weren't able to go to full conclusions because of the emergency use, so the trial really ended. But what it did show was there was a signal, which meaning it wasn't really necessarily significant, but it looked toward the favorable end. But in fact, in those patients, it looked like there was more of a signal or a favorable if you were, number one, less ill, and also not far into your disease process. So unfortunately, for the most part, what we understand is that if you are severely ill, you've probably had the disease for maybe 7, 8, 10, 12 days, and that's when all that immune dysregulation occurs. So really in those severely ill patients, by that time it's almost too late to use, because by that time you have the actual virus that has kind of been dampened by your immune system in general, and you have more of the immune dysregulation going on. So it's probably better to actually get it more early in disease and for more mildly symptomatic patients. So in the severely ill, no, you don't have to be severely ill to use it. It may not even be a benefit in that population. You are probably better off early in the course of disease or symptoms, and if you have more mild to moderate symptoms.
And the key in this is the antibody that your body produces, and there are some monoclonal antibody trials, which we're going to talk about next week, I think, that are starting here and across the country, and some of the preliminary data on that looks pretty good.
Yeah.
And that's actually going to be an outpatient therapy, which would be that's a game changer if it works.
That would be, yeah. And to your point about the antibody themselves, in those Mayo trials, they did look like there was more of a signal if you had higher antibody levels. And so to your point, the monoclonal antibody is just going to be massive amounts of this single type of antibody to help neutralize the virus. So you're exactly right.
That's technology I think that's been around for a very long time. Things that we can trust.
Oh gosh, yes.
I'm really that would be great if we get there, and I think it's going to work.
Air quality across Kansas is being impacted by wildfires out west. Does the smoke make us more susceptible to COVID-19, and can the virus survive in the blowing smoke?
Yeah, great questions. I guess as a lung doctor, I'm going to have to probably help answer this one. So air quality is being affected by wildfires, that's for sure. And the closer you are and the more you're on that wind path, then the more likely you are to be affected by that. The people who are really affected by it are usually people who already have underlying respiratory problems, and so asthmatics, people with chronic obstructive lung disease, emphysema, things of that nature are the people who are going to be most affected by that smoke. Does it affect the ability or make people more susceptible to COVID-19? I've not seen that, and I know that it's not carried magically. Coronavirus is not carried magically in the smoke. Yeah,
it's not going to be all the way from there to that, from the wildfires to here. But certainly if somebody is ill and outside and not wearing barrier protection, i.e. a mask, I don't think it's going to affect that transmission at all. But as far as will it make you more susceptible to infection, just as you said, I'm not sure there's data to suggest that, especially in the concentration it is here. Now, certainly if you are out west, that might be something a little bit different. We know, however, people are probably wearing masks in those environments as well.
And it's been said that the smoke from the West Forest fires has been over D.C., New York, so it's traveling in the jet stream. So
the only thing that I would maybe mention is that if we have issues with our air quality, is it impacting maybe respiratory symptoms, allergy type symptoms that are similar to COVID symptoms? So is it actually suggestive of COVID? Probably not. It's probably just the similar symptomology.
And to that point, if you're inhaling that, most of the time when you get infected with the virus, it's going to be in that upper respiratory tract is where the infection's going to set in rather than down in your lower. Obviously, it can set in the lower respiratory tract in your lungs, but for the most part, it's going to have infection in the higher parts.
So Heather, how about out in Hayes? How's the air quality been, and has it been impacted, do you think, by the fires in Colorado and California and the West?
Yeah, so the last several days we've had increased haziness across the sky. I can't say I've seen a lot of people in the office for it. Certainly more allergies and sneezing. I know my nose was stuffy this morning. The weather's cool enough. You're trying to open up your windows, and that's not working out as well for me. So, probably need to close our windows. The other thing I would say is that I think the people recovering from COVID, probably the smoke isn't helping that, I suppose, just their overall, oxygenation, and they've already got this inflammation in their lungs. So, I suppose that could hinder that recovery as quickly, or they might find, extended coughing period. But yeah, we're definitely hazy out here. Missed kind of our blue, shiny sky today.
You bet.
So we'll hope a few days. I guess they have a air quality tracker about 30 miles west of here, and it's higher than it's been in a long time, I guess.
Higher in a good way or higher in a bad way?
higher in a bad way. I think it's like 85 or something, about 30 miles west of here, where they must have a tracker out there. So that's kind of unusual, I believe. Out there.
I was going to say, because the air quality is usually pretty good out west, of the wind kind of blowing things around and keeping the not as dense and et cetera. So that's a concern, and undoubtedly related to those forest fires. Or as I saw somebody say today, the climate fires. So do masks that have a PM2.5 filter really have an advantage? Do they help us against COVID-19 or just allergies, Amanda?
So I'm not...
Talk to us about what these filters mean.
Well, I don't know exactly what this PM2.5 filter is. I think it might be a charcoal filter. It's not a respirator, which I think sometimes folks get the ones with the little filters confused with what a respirator is. And in the general population, if you're talking about COVID, you don't need a respirator. You need a face covering. You need at least 2-ply cloth mask or a surgical mask. Obviously, if you're in construction or you're dealing with other types of hazardous material, a respirator might make sense. But if you're asking what kind of mask do I need, I would say in the general population, you need a surgical mask or a cloth mask would be sufficient to cover your eyes, or not your eyes, your nose and your mouth, your mucous membranes.
And I was looking it up too. So it's 2.5 microns. So we know droplet sizes. For the most part, the majority of the droplet sizes, the average range is going to be 5 to 8 microns, very small amounts of what you kind of breathe out, or if you're laughing or yelling, will express on a normal level. Obviously, you can express larger micron droplets, and of course smaller, and people are really concerned with the smaller ones, the more of the micro aerosols.
Yeah, in part because they can move in further than the larger droplets tend to deposit in the very front, or maybe not make it into you. They fall to the ground a lot faster than the small part.
Yeah, but overall, I would just agree with what Amanda said. You know, the main thing is, I think maybe it can offer more barrier protection. Again, for the community, we want you to wear masks for barrier protection, so protecting other people in case you have the disease and you don't know it. Now, the masks also do offer some protection about getting it, so I think it could offer some added protection, but it's certainly not needed. The cloth masks, the 2 to 3 layer cotton masks are going to be sufficient right now.
So the next question is one that is near and dear to my heart. Can the virus enter through the ears? Well, let's be clear about something. You know, I vote presidential politics along the ear size. It's one of the reasons I like Barack Obama, is he's one of the few people on earth who've had ears as big as mine. When the wind blows, my earlobes blow, and you know, it's a challenge sometimes. But the truth is that as big as my ears are, and they are gigantic, I have not gotten sick because the ears do not transmit the virus. If the ears transmitted the virus, I would be a massive vector. And since that's not true, I think we're okay on the ear size. What do you think?
I would agree. I think there have been
You're
studies.
agreeing that my ears are massive thighs. Thank you, Amanda.
That was the first point I was agreeing with,
Yeah,
yes.
I know.
The second part was I don't think there's transmission associated with ears. Now, I do know that within ENT, if they're doing very invasive procedures within the middle ear, and I think there's even been studies that have shown that the virus has been within the middle ear after autopsy, but the likelihood of that being, the transmission risk is really unlikely, unless there's an aerosol. No, absolutely not. And again, in the healthcare setting, if you're actually doing an invasive procedure where there might be some kind of aerosolization, but it's also in close proximity to the other cavities. So I do not think there's any evidence to suggest it's transmitted through the ears.
No, I would agree. I'll talk with Dr. Sale and Dr. Lynn, but for the most part, you're going to have that barrier protection of the tympanic membrane, the eardrum anyways. Really, it's going to be the mucous membranes of the mouth, the nose, and the eyes. And of course, we know the eyes because the lacrimal ducts do drain down into the sinuses, and we know that there are receptors.
Okay, it's all about that receptor, right? And there's not a lot of the COX-2 receptors that are inside our ears. And,
Correct.
And so I think that they're really in respiratory epithelium and to some degree digestive epithelium. And so I think that's going to be the right way.
If it were transmitted through the ears, we would have known by now, because we would have so much more transmission.
So much more problem. And people like me would have been really just knocked out a long time ago. And we would have it would have been like evolution and natural selection. And so we'd only be seeing small-haired children. Should I wear a mask while working out at the gym? And the answer to that, I think, is going to be found in how safe the gym is. I mean, for example, I worked out this morning. Now, it wasn't really, I work out the same place, been working out there for years, but we're outside. We're outside on a hockey rink. And so people are really spread out. Don't wear a mask during that workout because I'm 20 feet away from everybody else. The wind's blowing, it's outside, it's great. A closed room, I think that's a different story, Amanda.
Yeah, I think it really depends on the how many other people are in the gym with you. What are the you can control a lot in the gym. If you're there lifting weights or you're there on a treadmill, where's the nearest person next to you? Have you wiped everything down? Are you expecting a large group of folks to be coming through in the middle of your workout? I would wear a mask in the gym. Obviously not if it's impacting my ability to breathe, but I think my recommendation would be, yes, you continue to wear a mask in the gym. And again, I think it really is dependent on, not every gym is the same size, not every workout facility is laid out the same way, so it really is dependent on what else is going on around you.
And I thought I had a picture that I sent to Logan right when the reopening started to show that, yes, you should be wearing a mask in the gym. I do. I know that some people in the gym don't. But I also try to work out when it's not at the peak hours as well. So that is one other strategy you can take. And if there's nobody in the room, even though the room is very large, if there's nobody else in the room with me, I do take it off. If there's even one other person in the room, I do keep it on. It does get tough. Hopefully it'll be a little bit better as the weather cools down, because even in those gyms, even though they're air conditioned, in the hot summer they get very hot, and the sweat is a problem. So sometimes I do bring one or two in case I do start getting sweat on the mask. But it is very important in those areas to wear a mask, and I would certainly continue to endorse that.
Heather, Hayes, gyms, masks, what do you think?
Yeah, I think some are wearing masks. We're trying to really make sure everybody is distanced apart and that everything's being cleaned. So if people are uncomfortable, because it's too hot and it causes them difficulty breathing or doing their exercise, they've done a good job here of just trying to do the social distance and really do great hygiene here. So, we've got a little bit less volume at times than someone in the city. So I think that kind of is a blessing for us at times for some of these activities.
And I would like to say, sorry, and that is for weights, but if you are doing classes or treadmill or something like that, that's going to be a little bit more difficult to wear a mask. So just kind of reevaluate your practices at that point.
So along the same line, how can I safely get acupuncture or a massage?
So I think this, again, goes back to your willingness to take a risk in what we know is you're going to have close proximity with somebody outside of your bubble. So is that acupuncture or massage therapy something that is more important to you, that you're willing to take that risk? Can it be done safely? Probably. There's, you have to pay attention to, again, wearing a mask, hygiene, avoiding contact with your face, your eyes, your nose, your mouth. So I think asking the facility where you're getting it done if they're doing what the safeguards they have in place. So I do think there are elements of it that can be done safely, but again, we know it's a higher risk activity than just staying at home.
And we know from the data in Springfield
absolutely.
About the two people, hairstylists who were in contact, both positive, were in contact with 140 clients. The clients had a mask, the stylists had a mask, and the disease wasn't communicated, which is pretty great data. Let's go to the next question.
Okay, so here's a good one for the weekend. I miss my friends. I want to watch football and spend time together. How can I safely expand my bubble?
And the Chiefs are playing Sunday at 3:25. We want to keep everybody safe. So how can we safely expand our bubble? Let's each get one quick word of advice from each of our folks.
If you are willing to be around your friends with masks on, if they haven't been a part of your bubble, I think that you can get together, maintain your distance, wear your masks whenever possible.
Okay, so Amanda Gartner says masks, distance. Heather Harris.
Try to do smaller groups. Over and over again, we see that it's the large groups that become the problem. And then just a kind of a conversation before everybody coming. Do you not feel good? It's the other thing we see a lot is people in hindsight go, well, yeah, maybe I didn't feel that great. So everyone taking their own personal responsibility. If you're not feeling too super, then to stay home and watch the game on your own.
Yeah, great advice. Okay, Hawkeye, pick it up.
Try to set up the TV outside.
Oh,
Yeah.
going outside.
Outdoors.
There you go. I like that.
The
I
Chiefs
like
play
that.
outdoors. You can watch it outdoors.
They do play out. That's good. Don't share the food, right? Make sure you're not all over the same food, coughing and sneezing or doing whatever. So I think we just made this a lot safer, but you are going to claim it to take a little bit of a gamble.
Claims of herd immunity happening soon and the virus disappearing have been in the news. Are both of these true?
Wow. Herd immunity soon, virus disappearing are both true. Okay, here's the options. A, both are true. B, one is true, or C, nah. What is it, Hawk?
You know, I was just going to say, in the town hall, the president did talk about herd mentality. That is something completely different. I'm going to say no for both of those, herd immunity and the virus is disappearing soon. Absolutely no.
Not going to happen yet.
Yeah, no.
No. Okay, Heather?
What I know is true is what is true. Do I get a choice?
No, you got to tell us the real truth.
Yes, we're looking for you.
Oh, the real truth. Probably not. I
Yeah.
don't think we're quite there yet.
You know, here's the part about science. You're not supposed to make it up. We're supposed to just tell the truth, and that way we can keep each other safe. It's when we start making it up that we bring in a whole bunch more risk. Hey, on Monday, Chief Medical Officers from Advent Health, Truman Medical Center, and Liberty Hospital are going to join us, along with the Director of Infectious Disease from Children's Mercy Hospital, as we look at how the Metro is doing now that we're back in school and after the Labor Day holiday. Today is also the last day for you to send us your list of 50 reasons to wear a mask. Now remember, I've already covered about 1,220 of them in this program between, where I cut myself shaving, the pimple, all sorts of stuff, my lipstick which goes wrong, my nose hairs are sticking out, lots of good reasons to wear a mask. We need to hear from you about all the great reasons that you've got for wearing a mask. We're going to start putting them out there next week, and Dana and I are going to sing to the tune of 50 Ways to Leave Your Lover.
Okay, I'll practice.
Yeah, we got to make it up pretty quick.
I do like Paul Simon.
Okay, maybe we won't sing. Wayne writes to us that these varsity girls in Parsons, led by VB head coach Brooke Hopper, play with their masks.
Yeah.
So does the Frontenac team. As a result, the team has avoided quarantine because of their stringent use of masks. Make sure you pull it up over your nose. Great job, ladies. Remember to keep that mask over the nose. That'll be that much more helpful. Here is Anita showing how a mask wearing allows her to volunteer at the Hillcrest Thrift Store, which is a special outreach going on to help the homeless during this pandemic. And June writes that mask wearing and physical distancing allowed for a graveside service for her father. We are sorry about your loss. She says they all wore masks out of respect for each other. And finally, Matt shows how he double masked and sported his eye protection on a flight from MCI to Phoenix. He says, Hawkeye should be proud.
Smart man.
Smart man. Well done. All right. So we want to say thanks to Heather Harris out there from Hays, Kansas, and appreciate your joining our program this morning. I'll see Heather on Wednesday. We're going to broadcast live from Hays because we want to talk a little bit more about rural Kansas, what's going on out there. So we'll be broadcasting live from Hays, and I think that'll be a great program. Amanda, thank you for coming back on Friday, letting us mess with you. And go Chiefs, love on the red. And Hawk, what are you doing this weekend?
I'll be watching football.
Yeah, it's the best.
In my own bubble with my son. So
that's the best. What are you doing this weekend?
I have some homework to do.
Oh, that's right.
And I'll be watching some football.
She's trying to get her PhD. We'll be getting her PhD. Heather, what are you doing this weekend?
I'm going to do some more golf. It's a great activity during COVID. Yeah.
It is great. I'm going to be going to the woods and camping again. What do you know about that? Shocker. Wow. Me and the ticks and the chiggers and my daughter doing a little fly fishing. Hey, listen, for you all out there, there is a way to stay safe. And I know it's a pain. I know it's not as much fun. And I know things are different. But it's not forever. Sickness and morbidity from being sick. Remember, it's not just about death. Death is bad. But so too are the chronic lung and heart problems and brain problems that come about from COVID. That's bad too. And there's a way to avoid the bad. So you don't have to beam up with Scotty, but you can put a mask over that dadgum coronavirus. Keep yourself safe. Keep your family safe. Keep your community safe. Keep us all safe. We'll talk to you on Monday. Have a great weekend. Go Chiefs.